So we're going to talk about some of the extra topics of the respiratory system. This PowerPoint, without being a video, is also found on Schoology in our respiratory system folder. I think it's one of the ones that Schoology is letting me upload at the moment, and I did email it to you as well last week. So some of the things we'll talk about are secondary functions of the respiratory system in addition to transport of oxygen and other gases, how our breathing is controlled, how our respiratory system protects itself and the body, and what our vocal cords do. So other than transport of gases, we've already talked a little bit about how the body filters particles out. We'll talk about that more. We talked about how the nasal cavity moistens and warms the air that we breathe in. So that's that second bullet point. We'll talk about how the vocal cords within the larynx help us produce sound. And then the other thing we know about our respiratory system is that it does play a role in our sense of smell, because obviously we smell through our nose and we have receptors that detect those smells. So normally, breathing is conscious. So we're aware that we're doing it. It's rhythmic. And so it follows a nice smooth pattern, and it's not voluntary, it's involuntary. It just does it on its own, even when we're sleeping. If you hold your breath too long, or if you pass out for another reason, your body will continue breathing on its own. So it's mainly controlled involuntarily. It's controlled here in the pons and the medulla oblongata, which are parts of your brainstem. Of course, we know that we can also voluntarily change our depth and our rate of breath. If I tell you right now to take a really deep breath in and a really deep exhale out, you can do that. If I tell you to breathe really, really, really fast, or to try to slow down your breathing, you can also do that. There is a voluntary component, but for the most part, it's involuntary. The rate and the depth of breathing can be changed, like I said, voluntarily or involuntarily. When we're talking about rate of breathing, we're talking about how many times per minute we're breathing, so speeding up or slowing down our breathing. When we talk about depth of breathing, we're talking about how much air we're getting in with each inhalation. So that we have our rate and our depth. Both of these are controlled involuntarily most of the time, but can be controlled voluntarily. When we need to get more oxygen in, or we need to get more carbon dioxide out, we'll increase our rate of breathing, we'll increase our depth of breathing. So one of the times we do this is during exercise. When you start to exercise, you'll breathe a lot more quickly and you'll breathe a lot more deeply until you have enough oxygen in or you've gotten enough carbon dioxide out, and then your breathing rate and depth will both go back to normal. We also have something called the inflation reflex. This is really important because it prevents our lungs from overinflating. Even though all the alveoli are microscopic, they're still like little itty bitty tiny balloons, little sacs in there. And so we can overinflate them. We don't want to do that. So instead of just breathing deeper and deeper and deeper, we have stretch receptors that will detect when we're getting to the point of it being dangerous to overinflate our lungs, and instead we'll then start breathing more quickly. So instead of just breathing more in with each breath, we'll just breathe more frequently so that we don't danger and overinflate our lungs. Some of the factors that affect breathing are oxygen and carbon dioxide levels, as well as emotions. Which do you think is more important? Oxygen levels being low or carbon dioxide levels being high? Which one is going to change your breathing more? Think about it. The answer is carbon dioxide. This is both oxygen and carbon dioxide levels work on a feedback loop to maintain homeostasis of these levels. And so they're going to work on a feedback loop using chemoreceptors. Chemoreceptors are receptors that receive chemical information. So in this case, they're detecting the level of gases in our body. So when the carbon dioxide levels get too high, these receptors will detect that, relay that information to the brainstem, which will then make our breathing rate increase. So we're going to breathe more quickly in order to push more air out of our body. The breathing rate will return to normal when the carbon dioxide levels go back to normal as well. So the carbon dioxide levels are always being monitored by these chemoreceptors. When they detect that they're back to normal, then our breathing will also return to normal. Carbon dioxide levels and hydrogen ion levels, as I mentioned before, they affect your breathing rate more often. They're more sensitive than the oxygen levels. However, oxygen levels can also affect breathing. The oxygen levels just have to be really, really, really low in order to trigger a response. In this case, when the chemoreceptors detect that the oxygen levels are too low, the breathing rate will increase in order to get more oxygen into the body. As we know, our emotions can also affect our breathing, whether this is fear, physical or emotional pain. It'll usually increase your rate of breathing, and of course, all of this, your depth of breathing as well. Whether you're surprised or you're anxious or you're crying or you're physically in pain, your breathing will speed up and will deepen because this is going to give your body more oxygen in order to prepare your muscles ultimately for a fight or flight response. So when you're breathing too rapidly, more rapidly than you normally would, this is called hyperventilation. Perhaps you've seen in movies or TV shows similar to this one of Sheldon from The Big Bang Theory here. You've seen someone hyperventilating and someone hands them a brown paper bag and they breathe into it and they start breathing normally. That does actually follow scientific sense. What happens is, as you're breathing out, you're only breathing into the paper bag. So since there's a greater concentration of carbon dioxide in the air that you're exhaling, there's a greater concentration of carbon dioxide inside that brown paper bag. You breathe that in, which makes the levels of carbon dioxide in your body higher than they would normally be, which then your chemoreceptors detect that and trigger a slower breathing rate because your body doesn't want you to keep breathing in too much carbon dioxide, so it will help calm you down. I do not recommend doing this. In fact, I would ask you not to, but sometimes swimmers will purposely hyperventilate or push off a lot of carbon dioxide in order to stop their natural reflexes. So what happens is they push off a bunch of extra carbon dioxide, which means that the carbon dioxide levels are lower, which will make your body not trigger your exhaling response, which will make the swimmers hold their breath longer. Again, not recommended because it can be really dangerous, especially if you pass out underwater. That's definitely not good. So our respiratory system, as we know, is supposed to get air in. However, there are other things in our air. There are dirt and dust and mold and fungus and bacteria and viruses and all kinds of other things that could be harmful to our body. And so our respiratory system has protective mechanisms, most of them we've already talked about, in order to get the air in but filter the particles out. So our nose, nasal cavity, pharynx, larynx, and trachea are lined with ciliated mucosal membranes. And so you can see that here are what are called goblet cells. They're going to secrete mucus, and that mucus traps any of these different particles that could be harmful invaders. And then the cilia are going to vibrate very quickly in order to sweep these particles away. They're going to sweep them away so that they can be coughed out. They can be sneezed out, as we know, especially those of us that dust makes sneeze a lot. They can keep them there in your nasal cavity to be blown out if you blow your nose, or you can swallow them and dissolve them. They'll get dissolved by the acid in our stomach. but the mucus traps them, and then the cilia moves them away to where they can be disposed of out of the body. We don't want these things to get into the lungs. The lungs, as we recall, are simple squamous, or the alveoli are made of simple squamous epithelia. So there's no mucous membrane there. There are no cilia there, because if we did have thick membranes or thick mucus, it would slow down the exchange of oxygen and carbon dioxide, and we don't want to do that. So if these itty bitty tiny particles reach the lungs, super, super small, we have white blood cells that will kill them and digest these foreign particles. So they'll still be able to not harm us if they get into our lungs, but it's only the super tiny ones, and we don't want to do this a lot. We'll talk about this in a minute. So as we know, we talked about it before, we have the epiglottis, and the epiglottis is going to cover the larynx so that when we swallow food, it pushes it down the esophagus, coming from the pharynx, instead of going into the larynx, the trachea, and the lungs. We want food out of there. If food does get into our trachea, it's called aspiration. Aspiration is when we inhale our food, when food goes into the respiratory system, which we don't want to do. As I'm sure has happened to all of us, our first response is to cough in order to force this food up. We don't want food to reach the lungs. We don't want anything that's not supposed to reach the lungs to get there, but especially food. If food gets there, you will have these macrophages that will try to get rid of it. However, in the case of something like food, it'll actually cause too much fluid to build up, which will cause pneumonia. And pneumonia is bad, as we know. You see on the left there the universal sign of choking. So if you are choking, that's the sign to make, or if you see someone making that sign, that's the sign that they need help. Now, if someone is still breathing, if you hear air going in or out, if they're still able to cough or speak or tell you they're choking, they're not actually choking. Choking is when it completely blocks the trachea, and so in which case that's when you'd use an abdominal thrust or the Heimlich maneuver in order to try to force that object out. If they are still coughing, you want to encourage the person to keep coughing. Some of you have learned this already in your jobs. If you've taken CPR for whatever reason, you'll have learned this as well.